Good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM Institutes. Today, we have got this speaking topic, which is very simple. But before commencing this speaking topic, I would like to remind few things because there are new students as well. And also there are no new YouTube followers as well who have been following us now for quite a while now, but still for everyone. So in speaking, you will get 3 minutes to prepare. So when you will be getting this cue card, first of all, there will be a warm-up questions. Warm-up questions are very simple, like asking about why do you want to go abroad, this and that. So you will simply say, I want to go to UK and I want to go to New Zealand because I think I would be able to explore more better things or maybe different things because the culture of working professional culture is entirely different. So there would be other things to learn personally as well. So I really want to go abroad, this and this, learn other skills, and also the communication part will become stronger. Learning other communities is one of my hobbies, to merge up with other people, to learn about other people. So I'm also going for exploring. It will help in my personal development. So you can say anything in the warm-up question. So you don't have to worry about anything. There is no marks, no nothing, no marks at all. So it's just to make you comfortable. Then you will get one role play. You will get 3 minutes to prepare. In those 3 minutes, you can read this role play and you can write anything on this role play. Then 5 minutes, you will have to act as a nurse or a doctor. You already are nurses and doctors. और आपके जो मार्क्स हैं इन्हीं 5 मिनट्स के हैं जब आप नर्स या डॉक्टर की तरह स्पीकिंग करते हो. कुछ भी लिखना अलाउड है. 3 मिनट्स आपको प्रिपेयर करने के लिए मिलते हैं, 5 मिनट्स बोलना है. देन अगेन फिर 3 मिनट्स मिलते हैं सेकंड रोल प्ले, फिर आपको 5 मिनट्स मिलते हैं. तो टोटल अगर मैं कहूँ तो टोटल आपकी जो स्पीकिंग सेशन होता है वो लगभग 20 मिनट्स का होता है, जिसमें 2 रोल प्ले होते हैं आपके पेपर में. हम डेली एक रोल प्ले की प्रैक्टिस करते हैं, पर मैं आपको बार बार कहता हूँ कि आपको एक रोल प्ले को 2 बार करना चाहिए, वो आपको और भी बेटर बनाएगा. स्पीकिंग को अच्छा करना है तो रोल प्ले को बार बार रिपीट करना चाहिए. रट्टा मारने की बजाय उसे समझ आएगा जब आप दूसरी बार करोगे, तीसरी बार करोगे. जब आप पहली बार करते हो तब तो सिर्फ रट्टा लग रहा होता है. अगेन सबसे पहले आपको सिचुएशन समझनी है. इमरजेंसी डिपार्टमेंट लोकल हॉस्पिटल. दिस 35-year-old पेशेंट वाज इन्वॉल्वड इन अ कार एक्सीडेंट अर्लियर टुडे एंड इज नाउ सफरिंग फ्रॉम अ हेडेक एंड विप्लैश इंजरी. तो एक पेशेंट है जिसको हेडेक हुआ था और सर्वाइकल स्पाइन में विप्लैश इंजरी है. ही इज बीइंग केप्ट इन द हॉस्पिटल फॉर ऑब्जर्वेशन बट इज एक्सपेक्टेड टू बी डिस्चार्ज लेटर इन द डे. सो बेसिकली हॉस्पिटल में ऑब्जर्वेशन के लिए, बाकी सब डन है. सो हम इसको डिस्चार्ज करने वाले हैं शाम को, यानी लेटर का मतलब है बाद में, लेटर इन द डे मतलब थोड़ी देर में, यानी कि शाम को आप पेशेंट को डिस्चार्ज करने वाले हो. सो आपका ये सिंपल सा रोल प्ले है, पेशेंट को डिस्चार्ज करने वाले हैं और सारी सिचुएशन आपको दे रखी है. तो आप ऑब्वियसली पेशेंट के पास जाओगे तो आप यही कहोगे ना, गुड मॉर्निंग, माय नेम इज बीकेएम, आई एम योर नर्स, सो हाउ आर यू फीलिंग नाउ. सबसे पहले पेशेंट के पास जाके यही पूछोगे ना, आप कैसा फील कर रहे हो. जब पेशेंट पहले से ही आपके पास एडमिट है, इससे अच्छी कोई बात ही नहीं हो सकती. तो ये लाइन जरूर लिखनी है, जरूर पेपर में हो सके तो पूरी लिखनी है. गुड मॉर्निंग, माय नेम इज दिस, आई एम अ नर्स ओवर हियर, सो वुड लाइक टू आस्क यू हाउ आर यू फीलिंग नाउ. गुड मॉर्निंग, माय नेम इज दिस, आई एम अ नर्स ओवर हियर, सो हाउ आर यू फीलिंग नाउ. बस इतनी सी बात आपको कहनी है और आपका रोल प्ले शुरू हो जाता है. फर्स्ट 2 लाइंस बड़ी इंपॉर्टेंट होती हैं. आपकी कॉन्फिडेंस की कमी ये सब फर्स्ट 2 लाइन से निकलती हैं. तो प्लीज बी सुपर एक्टिव इन दीज थिंग्स. फाइंड आउट द पेशेंट थिंग्स आर द रीजंस व्हाई ही इज बीइंग केप्ट इन द हॉस्पिटल. तो आपको कह रखा है कि आपको ये पूछना है कि पेशेंट को पूछो कि उसको पता है कि वो क्यों रह रहा है. सो आप सिंपल बोल सकते हो, डू यू नो व्हाई. बस इतना सा, व्हाई आर यू बीइंग, बाकी सब टेंस तो चेंज ही नहीं करना. व्हाई आर यू बीइंग केप्ट इन द हॉस्पिटल पहले ही लिख दो, लिख दो प्लीज, पेपर में सोचो मत. जो आपकी नेचुरल इंग्लिश है वो आपको सपोर्ट करेगी, जो मुश्किल लाइंस है उनको लिखो. क्या आपको पता है आपको क्यों रखा है, फिर उसको बताओ कि आपको ऑब्जर्वेशन के लिए रखा है और आपको कोई टेंशन लेने वाली बात नहीं है. देयर इज नथिंग टू वरी, यू आर बीइंग केप्ट इन द हॉस्पिटल जस्ट फॉर ऑब्जर्वेशन एंड यू आर एक्सपेक्टेड टू बी डिस्चार्ज लेटर इन द डे. सो प्लीज डोंट वरी. सेम लाइन, बस यू आर करना है. Advise the patient on the reasons for continuing to take medicine. Now, I would like to tell you the reasons that it is very important for you to take and continue your medications, because these medications will help to relieve your pain as you are suffering from headache. Also, you had an injury to the cervical spine. So obviously you will be having pain. So for this, taking medications on time is very important. Apart from this, once you go home, there are other ways of managing the pain, like using the heat pack or ice packs alternatively. Means you can use the heat pack, and then after 2 hours you can use the ice pack. They both have, अगर बताना है तो बता सकते हो, they both have their own importance. Heat pack helps in relieving pain by warming the body by increasing the blood circulation, whereas ice helps in the vasoconstrictions, means it helps in relieving the pain by causing vasoconstriction. So these are the two major phenomena. So it will decrease your inflammation. So ice will decrease your inflammation, and heat will help in soothing of the body or warming of the body. Then also we will give you a collar for your cervical spine. So please wear that collar as per the instruction that would be given to you by the doctor. So please make sure that you do all these things in the best possible way, because these things are very important, and these things are really very important, because you know these things are important just because you know if you will not do them in the right way, then you can feel further pain and further problems may occur. So it is very important for you to follow these instructions. So these are the things that you need to speak, and obviously you can learn from these things, and then after that explain that, describe the benefits. And now you should consult a physiotherapist about exercise and relaxation exercises, because they are very important to loosen up the joints. So they will help in relieving your pain. Apart from this, it will we cannot be sure, because when injuries like these happen, like whiplash injuries, so they are kind of internal injuries. Sometimes the pain is relieved within a week, sometimes it takes around 2 weeks. So you need to be patient, and you need to keep taking the medications when you have pain, and also after a week you will start feeling better. The last important thing is, again, I would like to remind you to comply with the treatment and exercise program, because they both will play a very important role in your recovery. Apart from this, it is very important to seek medical advice. If there is any increased pain or discomfort, nausea, vomiting, or any vision problems, if you have any of these problems, please contact the doctors immediately. So अगर आपको ऐसी कोई भी चीज होती है, पेन, डिस्कम्फर्ट, नोजिया, वोमिटिंग, तो आपको डॉक्टर को इमीडिएटली कांटेक्ट करना है. अब जब आपका असली रोल प्ले होगा तो आपको कैसे बोलना है, देखो. Good morning. My name is BKM. I'm your nurse. I'm a nurse over here. So I would like to know, how are you feeling now? Oh, well, nurse, I don't know. Like, I'm still having a lot of pain and all these things. Don't worry. Okay. So don't worry. Your pain will be relieved. I'm here to tell you about your medications and the routine that you need to follow after you go home. Okay, nurse, but would I be fine? Of course you will be fine. And do you know why are you being kept in the hospital? Well, nurse, I really don't know. Doctor is saying I'm all right, but still he wants me to stay. So I'm really confused whether he is sure or not about my recovery. Well, I would like to tell you that you are being kept in the hospital for observation, as you are having a bit of headache, and also you had injury to the cervical spine, which is kind of an internal injury. So that is why you are being kept in the hospital for observation, and you will be discharged later in the day. So there is nothing to worry. I am here to explain you few things, like importance of taking medications. It is very important to take medications or to continue medications, because medications will help to relieve pain, and whenever you have pain, do take these medication. Apart from these, there are other ways of managing pain regarding your cervical spine. So for this, once you return home, please use heat pack and ice packs alternatively. Means you can use heat packs for 2 hours. It will help to loosen up your joints, and you will feel less pain. Whereas when you will use ice packs, it will help in decreasing the inflammation. So these both things will help in the recovery. Apart from this, analgesics, as I have already told you, painkillers will play a very crucial role in your recovery, as if you will have less pain, you will be more positive, you will start feeling better. And also collar is very important, because when you have any injury to the cervical spine, collar play a very important role to stabilize that particular area. And I would like to tell you that it is important to follow these practices in the best possible way when you leave the hospital. It is very important to continue with these things. Now I would like to tell you one more thing. Patient की wait मत करो, मतलब patient से आप पूछ सकते हो have you understood everything, एक बार पूछ लो have you understood everything, वो कहेगा yes, इसके points मिलेंगे। have you understood everything, वो कहेगा yes, फिर आराम से। Now I would like to tell you about benefits of consulting a physiotherapist. As physiotherapists can teach you about exercise and the relaxation exercises which will help to loosen up the joints. So please, now you need to attend a physiotherapist. But nurse, how much time would it take for my recovery? See, we cannot be sure when the injuries are internal. Like in your case, you have whiplash. It can take 3 days, 4 days, or maybe a week. So at this point of time, we cannot be sure that how long will it take to recover fully. And now I would like to remind you again that complying with the treatment and exercise program is very, very important. And one more thing that is important is if you feel any kind of increased pain, discomfort, nausea, vomiting, or any kind of vision problems, then it is very important to seek the medical advice immediately. Are you understanding? Okay, then don't worry. I reassure you there is nothing to worry. You are just being kept in the hospital for observation and you will be discharged very soon. Rest, it is very important to follow the medication and the physiotherapy regime for your speedy recovery. Is it all good? Okay, then take care. This is how you speak your complete role play in the best possible way. Please अच्छे से करना, repeat करना, 2 बार सुनना, 3 बार सुनना जो नए बच्चे हैं। 3 मिनट्स आपको प्रिपेयर करने के लिए मिलेंगे। अपनी नोटबुक उठाओ, अपनी पेंसिल उठाओ, जो मैंने बोला है उसको लिख के देखो, फिर उसको पढ़ पढ़ के 3-4 बार बोलो एक रोल प्ले को। जो नए स्टूडेंट्स हैं उनको ये जरूर करना चाहिए। दिस विल हेल्प देम इन लर्निंग स्पीकिंग। स्पीकिंग से ही कॉन्फिडेंस की शुरुआत होती है। अगर आप स्पीकिंग नहीं करोगे तो आप परेशान रहोगे। तो इसका तरीका ये है, इसको लिखो और लिखने के बाद 3-4 बार बोलो। जब अपने टीचर के साथ करते हो, जो आपकी स्पीकिंग होती है, टीचर के साथ करने से पहले आपको 3-4 बार अपने साथ करनी चाहिए। It will help you in the best possible way. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. And please listen to this video 2-3 times at least and subscribe our channel. Thank you.